Morning. Thanks everybody for joining us. We're going to give it a few seconds while the queue gets let in here to the webinar. I'll get going in about 30 seconds. We've got a lot of people joining right now. Right. Well, good morning and thank you for joining us. Welcome to May's edition of Eggheads, Colorado Health Institute's monthly breakfast time webinar. Today, we're looking at the 2023 legislative session, which just ended on May 8th after what seemed like about 5 years in session, probably. A few notes to start off today. The session's being recorded. We'll post the recording on our website, coloradohealthinstitute.org, later on today. If you want to ask a question, there are a whole bunch of ways. You can use the Q&A button or the chat feature at the bottom of your screen. We're monitoring both of them. You can also, and this is what I would love, is to raise your hand, and then my colleague Biani will be able to find you in the list, and then we can put you on audio, and you can ask a question or make a comment, and that just kind of makes things a lot more interactive than us rereading a printed comment. I'd love to just get a sense of who's here and also test out that chat feature. So if you wouldn't mind, take just a second right now to open up the chat, make sure that it's set for everyone to see instead of just host and panelist, and just tell us who you are and where you're from, or if you're representing an organization. All right. We have Project Angel Heart, Doug McCarthy from Durango. Hey, Doug. Good to see you again. Got Alan from Colorado Academy of PAs. Taylor McBride joining us from Roaring Fork Valley. I see Shannon from the Thompson School District, some state partners from CDPHE. More people from Durango. I love it. I used to be a Durango Herald reporter. All right. Well, thanks everybody. You can browse through and see who else is joining us this morning. Here's what we've got on tap for you today. We're going to do about a 15-minute overview of the 2023 legislative session with our legislative team, who I'll introduce right now. Allie Morgan is our Director of Legislative Affairs. She's been a CHI for about 9 years and just knows the legislature inside and out at this point. And then Kendra Newman is a research analyst on our legislative team. And honestly, she's the brains behind this presentation and our forthcoming report on the legislative session, Legislation in Review. So after Allie and Kendra take us through the session, we're going to shift to a discussion with two really special guests from the legislature. They'll talk about the session with an emphasis on behavioral health, which is such an important priority for Colorado right now. We'll be joined by Representatives Judy Amabile, a Democrat from the Mountain District in the North Front Range, centered around Boulder County. And then Dafna Michaelson Jenet, also a Democrat in the House, representing Northeast Denver and Commerce City. Both are members of the Public and Behavioral Health Committee in the House. Both have been champions of behavioral health system improvements, and both are moms with personal experiences of raising a family at a time when young people's mental health is under such strain. With all those preliminaries out of the way, I'd like to turn it over to Allie to start off our session. Thanks.
Wonderful. Thanks so much, Joe. And good morning, everyone. It feels like just yesterday that we did our last Eggheads on the legislative session, but here we are again in May somehow. And we're excited to spend some quality time with all of you this morning. It should be a great conversation. And again, we're just really excited and grateful for our legislators for taking time to join us today as well. So briefly, for anyone who might not be familiar with the Colorado Health Institute, on today's call, we're a nonprofit mission-driven research and consulting organization. We work to advance equity and well-being in our communities through deep expertise and implementational know-how. We've been working with community groups, providers, state and local government agencies, foundations, and yes, elected officials for more than 20 years. We provide support with trusted data, strategic planning, facilitation, communications, the list goes on. And then in addition to our consulting work, which is for organizations who share our mission of advancing health equity, we have a public-facing portfolio of work that's funded by philanthropic supporters that includes our legislative services. CHI was actually founded back in 2002 with the aim of providing unbiased health policy support to elected officials and their staff. Some of you might remember when that happened back in the day. And today, we still help decision makers at local, state, and federal levels with independent research and analysis to inform both policy and practice. We offer many different services, including but not limited to research and analysis on legislation and its impacts, including a post-session report that we call Legislation in Review. I think you can expect that probably late next month. District-specific data snapshots for legislators, primarily highlighting data from our in-house Colorado Health Access Survey, or CHAS. Nonpartisan briefings for legislators and staff on a wide variety of health and health-related topics. Neutral testimony, if we're invited, to explain often complex or controversial health policy topics. Sometimes this is a helpful way, for example, to kick off a contentious bill debate or committee hearing. Virtual or in-person town hall presentations. It's been fun to get back to these finally in person this year after a lot of years on Zoom. And program evaluation to help understand the impact of new laws and initiatives. And then I'll just say that we believe so strongly in this work and in the importance of having an objective evidence-based voice informing health policy conversations, which, as you all know, can sometimes get just a tad political. We are always happy to connect if you'd like to learn more about how CHI can support your work or your organization with legislative activities or otherwise. We'll share our emails in the chat with you today, so you have those, but don't hesitate to reach out. And with that, let's turn to the session. While some of the figures on the screen I'm going to show are still being finalized, we just wanted to kick this off with a look at some of the numbers that we thought defined the session. So 617 bills were introduced in the 2023 session. This was actually 40 bills fewer than the prior year, but still just a lot to get through in 4 months' time. 486 of those bills were sent to Governor Jared Polis for signature, and that pass rate of 79% is almost identical to last year's. However, I just want to note that that pass rate does not take into account governor vetoes, and so far we have had 6 of them. The governor still has a couple of weeks until June 7th, I believe, to make final decisions on bills, so that number could increase. And as usual, a large number of decisions happened in the final days of the session. For example, with just 5 days remaining, more than 180 bills, or nearly a third of all bills introduced this year, had yet to be decided. Once again, we saw some major debates happening on the final day, really down to the wire. And each year, CHI is just reminded of how many bills really qualify as being health-related or health-adjacent. Our small but mighty legislative team watched 194 bills on our internal health tracking list this year. Those efforts, as Joe alluded to, were really led by my colleague Kendra, who you'll hear from in just a minute. And I just want to note that going into the session, there were a lot of new faces, which has plenty of impacts for policymaking. 33 of our legislators were brand new to the Capitol this year. And that number actually rose to 43 when you factor in those who were new to their chamber. So that's just a lot of turnover and fresh faces in a 100-seat legislature. And the margin of Democratic control was substantial. Democrats had 46 seats to Republicans 19 in the House, another supermajority, and that's a 27-seat advantage. And then in the Senate, there are 23 Democrats to 12 Republicans. And that, again, just has lots of implications for the types of debates that we hear and the types of bills that we see pass. So I'm going to turn it over now to Kendra to walk through some of our takeaways about what Democrats did with that margin of control this year in the legislature.
Great. Thank you so much for that introduction, Allie. And I'm excited to get to talk to you all about a few different key themes and dynamics before we turn it over to our legislators to discuss the legislative session in a little more detail. And I do want to start by just chatting a little bit about the Democratic Party, because Democrats did hold wide margins in both the House and the Senate, and because we have a Democratic governor. And with that trifecta of control, we saw that Democrats were able to pass a lot of pretty significant and pretty bold policies this year. And they passed almost 500 bills, so there are plenty of topics we could zoom in on. The two that I really want to spotlight right now were the reproductive health bill package that was passed this session, as well as a few of the gun safety bills that Democrats pushed through and passed this session. And these two bill packages are really notable because they were both pretty partisan and controversial topics that were opposed by the Republican Party. And yet they moved through the process pretty quickly, and they gained support from a lot of Democrats in the caucus, including both more moderate and progressive Democrats, as well as from leadership in the legislature and from Governor Polis. And the reproductive health bill package was pretty interesting in its own right, given the policies that were passed, which included things like protections for providers who provide reproductive health care services, including to those who come from other states, expanding some of the insurance requirements for both reproductive and sexual health care services, as well as a bill that implements some regulations on how crisis pregnancy centers are allowed to advertise their services. And these reproductive health bills passed almost unanimously among Democrats, with just a couple of exceptions. Similarly, the gun safety bills that we saw that actually got through the process and did pass and reach the governor's desk were pretty widely supported as well, although not quite as unanimously. But we still saw broad support across the Democratic caucus for things like raising the minimum age of gun ownership from 18 to 21, implementing a 3-day waiting period, and banning ghost guns. And these bills are pretty notable, as I said, because they are controversial, highly partisan topics, and because they are pretty notable in the national consciousness as well. Reproductive health and gun violence are both big topics nationally. And that meant that when these bills were signed, we saw a lot of national news coverage of these new policies and a lot of discussion about the fact that these policies both represent the fact that Colorado is becoming an increasingly blue state. And these bills were highlighted as potential national models for other states that might want to implement similar progressive policy in the reproductive health and gun safety spaces. And yet, in spite of some of this bold policy that Democrats did come together as a caucus to pass, we also saw some disagreements within the Democratic Party, which meant that Democrats were not able to get through their entire agenda. And this was particularly true among progressive Democrats, who have been less likely to hold leadership positions in the legislature. Progressive Democrats struggled to pass their priority bills on a wide range of topics, including assault rifles and public safety, harm reduction and substance use, and housing and tenants' rights. And I will call out just a couple of the bills that progressive Democrats really championed that ended up dying because of these intra-party struggles and disagreements. Some of the most high-profile of those bills included a proposed ban on assault weapons, a bill that would have allowed cities to open overdose prevention centers, also often known as supervised use sites. And then there were a couple of housing bills that really became very high-profile towards the end of session as focal points of disagreement within the party, including a bill that would have given more power to local governments to impose rent control measures, as well as a bill that would have given the state more control over zoning requirements and ban single-family zoning in cities. All of these bills failed despite the support of progressive Democrats. And then we also saw that lobbying groups played a big role in limiting parts of the progressive Democratic agenda this session. At the beginning of session, there was some question about how much control some of these long-standing influential lobbying groups would hold. But we saw, for instance, that local government lobbyists played a really instrumental role in killing that bill around giving the state more control over zoning requirements. And we also saw that the hospital and the business lobbies played pretty big roles in either paring down or completely defeating bills that Democratic sponsors had touted as very important for either patients' or workers' rights. There are plenty of bills that I could call out as examples, but just a couple key bills included House Bill 1215, which started as a ban on most hospital facility fees, and after strong hospital opposition, ended up being significantly pared down. And then the business lobby also played a key role in defeating a bill that would have, according to Democratic sponsors, provided more predictable pay and scheduling for hourly employees. And so taken all together, these bills really highlight places where Democrats struggle to come together as a caucus and pass certain bills, despite the fact that in many other areas, they passed some pretty innovative and influential policy. And now I do want to quickly step away from some of these partisan politics to talk about the budget, which of course plays an important role in every legislative session. And this year, the budget did continue growing, but we also saw that federal funding due to COVID had ended, which meant that on the whole, the Joint Budget Committee and the legislature had a smaller pool of money than they've had in 2021 or 2022 for new programs and initiatives. And that meant that the legislature had to make some decisions about which programs might not get funded or might not get fully funded, given this slightly more limited pool of funding. One of the notable examples of a bill that did not get funded despite policy support was a bill that would have banned step therapy for Medicaid patients receiving treatment for serious mental illnesses. This bill seemed to have support from across the Democratic caucus on its policies, but because of a high fiscal note, never received an appropriations hearing and did not pass. However, we did see that Democrats and the legislature as a whole devoted a lot of time and attention and new initiatives to pocketbook and cost control issues, which has been a theme for a few sessions now. We've seen several sessions of big initiatives and big programs aimed at cost control in various spaces. And this session in particular, some of the themes we saw were bills and initiatives focused on healthcare costs, on affordable housing, and on taxes. Within the healthcare cost space, one pretty notable bill that I'll call out was a proposal to limit the cost of EpiPens or epinephrine autoinjectors. We saw both failed and successful affordable housing initiatives. And one of the successful initiatives that was actually championed by the governor was a bill that would ban local housing growth caps. And meanwhile, the last week of session was really taken up with discussions about taxes and fiscal policy, with the legislature right at the end of session passing bills on flat tabor refunds and on property tax relief. And so finally, now that I've gone over some of those big fiscal and partisan dynamics of the session, I do quickly want to zoom in on behavioral health, given that that is one of the focuses of today's panel. And just highlight that that continued to be a priority for many legislators this session, as it has been for several sessions in a row now. We saw many new programs in particular that really focused on funding for and access to behavioral health screening and treatment. And while I don't have time to go through every single successful bill, a couple of the most notable ones included a bill that creates a new program for mental health screenings in some middle and high schools, bills that focused on the prevention and treatment of eating disorders, as well as a new program that's aimed at improving access to behavioral health treatment for veterans. And alongside this flurry of bills, we also saw a bill that makes some implementation changes to the new Behavioral Health Administration, or BHA, which was stood up in 2022. Given some of their staffing challenges, including shortages, we did see that this year's implementation bill actually pushed back some of the BHA's deadlines, including its deadline to take over certain licensing responsibilities and its deadline to stand up a network of behavioral health administrative service organizations, often known as BASOs. We at CHI will be continuing to track the progress of the BHA, particularly given the fact that is responsible for many of the new programs and initiatives that passed this year. And so with that, I am really excited to turn it over to our panelists. But first, if you are interested in reading any more about the legislative session, our legislation in review will be coming out next month, as Ellie mentioned. And we'll have deep dives on all of these topics, as well as others, like climate and environment and social supports. So you'll see our emails on the screen, and I believe my colleague Allie is going to drop them into the chat as well. And with that, I will turn it over to my colleague Joe to introduce our panelists.
All right. Hey, thank you so much, Kendra and Allie. Let's get into the discussion with our two legislative representatives. Again, thank you so much, Representatives Michaelson, Jenet, and Amabile, for joining us today. Let's get some leave as much time as possible for the audience to ask questions. Again, the best way to do that is using that raise hand button, and then my colleague Biani can find you and unmute you, and you can ask the question live. If you don't want to do that, we also you can use the Q&A or the chat feature here. I'll get us going with just a general question about behavioral health during the 2023 session. Question for both of you in turn. What are your overall impressions on how the legislature did with behavioral health issues this session? And is there one particular win that you would like to highlight? Who'd like to take that one first? All right. It looks like Representative Michaelson Jenet is pointing to Representative Amabile.
All right. I should have pointed first.
Yeah.
First of all, let me just say thank you so much for having us here today. It's really an honor to be here and to see so many people who are interested in this topic who are attending. I would say that behavioral health has really become a much more a topic that's of interest to way more people than it was when I first started 3 years ago. So we have Democrats and Republicans and House leadership, Senate leadership are all interested in behavioral health. And I don't think that has always been the case. And I think I would say Representative Michaelson Jenet's leadership on this topic has really helped to elevate the conversation all throughout the legislature and in our state. So I think we did really well on behavioral health. Last year we had all this money to spend, so that was super exciting. And it felt like we were really gonna change the world with all that money. And this year we didn't have money to spend, but we had a lot of policies to continue to work on. So in some ways, it seemed a little bit less monumental, but I guess I feel like everybody's on board for talking about it. Like I was one of the prime sponsors of the 3-day waiting period, and the conversation for that bill was really around suicide prevention. And we didn't get any Republicans to vote for it, but they did understand that was a problem in their districts as every bit as much as in blue districts. And so I think we actually moved that conversation forward a little bit, even though we didn't actually get them to vote on it. And for me personally, the big win of the session was the prescriptive authority for psychologists. So the bill 1071 allows PhD psychologists who also go back and get a master's in psychopharmacology and do additional training with licensed providers can eventually become prescribers. And that to me really opens up a lot of opportunity for people to get care that is easier to access and is less expensive. And I believe it will be more effective for a number of people. So I think most people know that I have a son who has schizoaffective disorder. And right now he goes to a therapist and then he has a prescriber. He sees that therapist a lot more often than he sees the prescriber. He has a better, more intimate relationship with the therapist than he does with the prescriber. And I think overall he will get better care if he were able to have that same person managing his medications. And I think that will be true for a lot of people in our state. So I hope that's a full answer to your question.
Oh, definitely. Thank you. Thank you. Yeah.
So I'll jump in. First of all, let me echo all of Rep. Amabile's sentiments, and I'm so grateful that she has entered the legislature because it was a little bit of a lonely position, but it became less lonely when Judy and Mary joined the legislature, and now I feel like I have a team, which is amazing. I want to correct one thing. The serious mental illness bill did pass. It's the biomarker bill that was stopped because of its high fiscal notes. So we're still hoping for a signature on that bill to stop step therapy in instances of serious mental illness. And we'll just have to watch and see as the signing period stretches on and on and on and on. So that's a little bit from here. One of the bills I'd like to highlight that I'm most proud of is our youth mental health assessments in school. We know that youth are 6 times more likely to participate in a therapeutic intervention if it happens at school. And we are also aware that universal assessments is the way to get kids into therapy more quickly and potentially ward off the suicidality and serious anxiety that's landing our kids in the emergency room at such high rates right now. So it was House Bill 1003, and we will hopefully start seeing that roll out soon. It also has not yet been signed, but fingers crossed.
Let me just jump in because there were actually 2 step therapy bills. One was your bill that passed, but the other was about Medicaid.
Oh, that's right.
That one
Did not
failed.
pass. Okay.
Yeah.
Sorry. I
Hard
stand
to-
corrected.
So much going on that, yeah, it's hard to keep track even when you're in the building, I'm sure, or maybe especially when you're in the building. Yeah, I'm glad you mentioned the screenings in schools. CHI did a report early this year saying, hey, it'd be great if we had universal screenings in schools. And then I would love to take credit for being the mighty powerhouse that passed this bill, but no, we just pointed out that it'd be a good idea, and obviously you were already working on that. What I'd like to look a little bit ahead though. Say, we implement this bill and we get more kids screened and issues surface earlier before it becomes a real crisis. But then we still have this problem with where the kid needs a referral. Who do we refer them to?
Right.
Have so many holes in the continuum of care and the workforce here. So what's on the horizon ahead for behavioral health, and especially trying to plug some of those gaps that Colorado has?
Well, let me start with answering what are we going to do with the kids from 1003 who screen for therapy and are identified as youth who could benefit from a therapeutic involvement. And one of the reasons that this was the time for 1003, besides for your amazing article, which I did use over and over and over again to convince people of the need for this program. So I'm very grateful for that article. We have the iMatter program, and the iMatter program has been providing a pathway to therapeutic involvement for our youth in a more swift manner than our insurance companies have been able to do. And it's free for your first 6 sessions. So I think what we anticipate, and we checked with iMatter and questioned whether or not they would be able to staff up to meet the needs of more youth, and they said yes, is that we need to make sure that iMatter is a constant or a continuous program. And that is one of the things that I'll be working on next legislative session, to make iMatter a permanent program.
Great to hear.
Yeah, I'll jump in here too. I think part of your question is about workforce. Do we have the behavioral health workforce that we need to handle more kids being introduced to therapeutic resources, but also those kids become adults? And do we have the resources we need to handle that? And of course, the answer is no, we don't. We do need more. We need more people to take up these professions, and we need more funding for providers. And we need better funding from Medicaid for the Medicaid providers, because they're dropping out because they're not getting the reimbursements that they need in order to have a healthy practice. So we did do some things this session that are about giving free training to people who want to go into these high need professions. So, and some other apprenticeship programs and things that are geared towards getting more young people interested in healthcare professions. And I think that will take some time, but it will also eventually pay off. And I think the second thing that's going to help is getting the BHA launched. And you mentioned the BHA update bill, and I was one of the prime sponsors with Rep. Mary Young on that. And that bill really went through a lot of transformations along the way. It started out with a few tweaks and some really needed additions and a short delay. And between the time it was in the House and the time it made it over to the Senate, a lot of things had changed at the BHA, and a lot of more information had come to light about where they really were in terms of implementing the policies and programs that the BHA is meant to stand up. And it turns out they were a lot further behind than anybody knew. And so all those deadlines had to be extended. And I just want to say that for me is totally heartbreaking, because every minute that we delay, we have people who are literally dying, who are depending on this safety net to get stood up. And so that's something we really have to make sure we stay on top of next session.
I'd like to follow up on that. I'd also like to encourage our audience to really, we're having a great conversation here, but I want to hear from some folks in the audience too. I'm looking at our roster here, and I'm sure there are a lot more incisive and smarter questions out there among you all than I'm posing right here. So please don't be shy. But I do want to follow up on the BHA. Representative Amabile, you wrote an op-ed earlier this week, I believe, in the Colorado Sun about the BHA and the delays. Do you think the vision behind what the BHA was supposed to be, is that still solid? Is that still doable? Have the delays been because it's because of something, you're just trying to do something that can't be done, or are you still committed to the idea behind it?
Yeah, that's a great question. I'm committed to the idea behind the BHA. I have been skeptical right from the start. Before I was a legislator, I was a parent desperately seeking help for my kid, and I went to give testimony to the task force that got the BHA going back in 2018. And when the final report came out, many of us who had gone down there to testify were a little bit let down by, here's the result of this massive effort, is we're going to stand up another agency. And that didn't seem like enough. And it seemed also like, okay, we're just kicking the can down the road. Since that time, obviously, I'm a lot more knowledgeable about the whole system and not just the way the system impacts me and my family. But nothing's changed. So nothing has changed for me and my family, and for the group of families that I am in regular contact with. And that's disappointing. But what we have in place right now is to stand up the BHA. So yes, I'm committed to making sure that the BHA works, that the BHA does what it's supposed to do, and that the safety net is stood up. So I'm going to do everything in my power to help that process along.
Right, thank you.
And
We're starting.
and she has been
ahead.
doing, and she
Yeah.
has been doing everything in her power, and we are standing behind her. We also desperately want to see this stood up in an appropriate manner. We want to make sure serious mental illness is getting the attention it deserves, substance use disorder treatment, mental health in general. And I know that with the team in place, we're not gonna let it fail.
All right, thanks. We're getting some audience questions now. I see Shannon, I believe, Laura and Doug. Biani, do you want to, let's start with Laura. I think you're unmuted. Please ask your question.
Great, thank you so much. Laura Cinconi with Douglas County and the Mental Health Initiative in the county. And kind of fangirling over here. I just want to thank you both for your representation and your work this session. So I want to talk a little bit, go back to the workforce. And I've started reading a book by the former director of the National Institutes of Mental Health, Dr. Insel, and it was published last year, so relatively recent data. And he mentions that there are over 700,000 mental and behavioral health providers in the United States, which is up there as far as specialties. And that doesn't mean that they're equitably distributed within states and across the nation. But it's going to take us some time to build the workforce, right? And it just makes me think, though, we have a lot of providers, but the demand is so high. So, you spoke about universal screening, and I'm wondering if in this session or if in conversations that you've had, if there have been any other prevention or health promotion bills of note, so we can kind of divert from needing, people getting to the point where they're needing office-based or other kind of deeper end assistance from mental health providers. Thank you.
Yeah, Judy, do you mind if I jump in first? So one of the things that I want to highlight is the annual mental health wellness screenings that we now insurers in Colorado are required to offer a free annual mental health wellness screening to all of their clients, no matter what age you are. 45 to 60 minutes with a qualified mental health care provider. And there's a whole list of who those providers could be. And the goal here is the right level of care at the right place at the right time. If you start taking care of your mind like you take care of your body, now most people don't take care of their body very well, so I would recommend taking care of your mind a little bit better than you take care of your body. But if you start taking care of your mind on an annual basis and know who to go to, set up your primary mental health care provider, you won't find yourself in crisis not knowing where to go and ending up in the emergency department because you have nowhere else to go for help. So it's that, again, right level of care, right place at the right time. And the idea behind 1003 this year is that same thing. How do we get kids into social workers before they need psychologists, before they need psychiatrists, so that we are actually spacing out the levels of care, and the people who need the psychiatrists can actually reach and get an appointment with the psychiatrist. And so I think that, you know, as we look at legislation, as we look at programs in our community, it's always about how do we spread the wealth? How do we make sure that people are getting that right level of care from the right provider? And I worked a little bit with the president of UC Health, who had worked, I believe, in Pittsburgh. Don't quote me on that, I could be wrong. And he talked about how when they went to the right level of care, right place, right time, they saw a shaking down of the system where there were more appointments available because people were going to the right place. And, you know, if we're not fully utilizing our social workforce, we are missing out on the core of helping to provide therapeutic support for our youth and our adults and our families who need family counseling. So I do what I can to make sure we get that baseline served. And I hope, you know, the one thing that I feel was a big mistake in annual mental health wellness exams from the insurance side was we didn't put money into advertising. And so not a lot of people know that they have a right to this benefit in Colorado. So we're trying to spread the word in whatever organic ways that we can, because people won't start taking advantage of this unless they know it exists and have rationale behind it.
I thank you for that. I wanted to just address the question from the other side, which is the Medicaid side. So our Medicaid patients here in Colorado, of which there are about 500,000, are not getting equality in terms of care, unfortunately, and in terms of preventive services and those things. Like we couldn't get the step therapy for Medicaid patients because the state has to pay for that, as opposed to the insurance companies. But also the Medicaid reimbursements for providers are inadequate. And there's a lot of bureaucratic hoops that they have to jump through to be Medicaid providers. And so I saw a couple of questions in the Q&A about what's the landscape of getting those Medicaid providers better reimbursements so that they're willing to see Medicaid patients. And that's a huge lift, because that comes out of our very constrained budget because of Tabor, and it isn't a hugely high priority to treat Medicaid patients. And of course, these are some of the people who, like the people with the absolute most serious mental illness, are largely on Medicaid, because if you have schizoaffective disorder or schizophrenia or bipolar with psychotic episodes, it's hard to work. So these are people who are desperately poor and have serious illness. And I feel like those people are just dramatically being left behind untreated. And to Dafna's point, they would really benefit from treatment that is proactive rather than reactive.
All right, let's continue on with that thought. I think Shannon Jenkins has a question about workforce, particularly in public education. Go ahead, Shannon.
Hi, good morning. I'm Shannon Jenkins. I'm the mental health coordinator in Thompson School District in Loveland. This is my first year in Colorado. If you can't tell, the 85 y'alls are going to slip through. So I just want to tell you that it has been so refreshing and just quite lovely to see the tireless advocacy in the area of mental health. So from the bottom of my heart, thank you both so much. And thank you to this group for all the work that you do. So I guess, you know, as we're talking about this vacuum of, you know, lack of providers in the private sector, take that and let's extrapolate that for what's happening in the school districts, because we have such a just abyss, and lack of providers in the area of recruitment and retention of mental health providers, just because salaries can't compete with what they can make in the private sector. So I guess one of my questions is that are there plans to continue? I know there's a lot of work that's always around school finance reform, but are there plans to continue to close that gap, specifically in the area of maybe even incentivizing those areas where we have vacuums of personnel? So I'll be quiet and thank you so much.
I'll jump in. So we've had a number of bills that were directed specifically at increasing the number of mental health professionals in schools. And the challenge we have is what you stated. Even though we are putting money towards it, it is not enough money. And we have to recruit and train and bring these people in. And that falls under the general other employment problems that we are facing in our communities. So we will continue to try and support and bring more money towards behavioral health services in schools. And we've seen some increase, if you're familiar yet, with school-based health centers, with their staffing up on mental health care providers. And I think the other thing that we need to realize and recognize when we're talking about school-based professionals, there are differences in the therapeutic interactions they provide, whether it is a standard school psychologist interaction, which is ready to help students be in the classroom, versus a therapeutic intervention that they might be able to get at a school-based health center, which is therapy to address the root issues of depression or anxiety or stress, et cetera. So, as we're looking at this, I want to see more of the providers who provide therapy to be available in the schools, because we know that's where students can access therapy, and we know that they're more likely to maintain their therapeutic treatment if it is done in school. So it's a big question. I didn't give you an answer other than we're trying, and we will keep trying. And thank you so much for your service in our schools. And welcome to Colorado.
All right, we've got a good question from Kelly about removing this discussion from treatment and getting kind of like, I think you just mentioned root causes. Kelly, I think you are, yep, you are on, so you can unmute and please ask away.
Great. Thanks so much for taking my question. So I'm wondering if we can discuss the influence of mental health beyond access to mental health care. As we know, in the physical health world, only about 20% of our overall health is really determined by the health care that we receive, and other is, more determined by our social context. We also know that adverse childhood experiences, these experiences happen very early in a child's life, have long-term impacts and on both mental and physical health. So how are we addressing preventing these types of experiences for very young children and their families, so as to try to prevent the mental health crises that we see later in life?
That's a really excellent question. And since I'm the mommy legislator, I'm the youth mommy legislator. Judy here is the adult mommy legislator. So when we think about how do we prevent ACEs and how do we prevent the trauma that is happening in our students' lives, one of the ways that we're working on that, and I have a bill next year called that's working on a program that trains teachers to identify and to refer. So it doesn't train teachers to be therapists, but it trains them to identify and refer. So what would it look like in an environment where kids are gathering and teachers were aware of what caused ACEs and were able to step in if they saw an experience happening that they could help turn around? and help change from an adverse experience. And I think that, we've piloted this program in 3 districts. I'm not going to remember what they are right now. They're 3 rural districts. And I'm looking to bring it to more schools so that we are able to reach our kids. From where I sit, the work that we can do is reaching our kids when they're in school. We also need to reach our kids when they're at home. And what are the ways that we as a community could step up? I really appreciated the Surgeon General's warning on social media that came out the last couple of days. We are all learning how to raise children in the social media age. And adults are as much addicted to social media as youth are addicted to social media. So how do we start modeling healthier behaviors around social media? What are timelines and constraints that one could put on a child that they're not going to fight back on, and they're not going to just, that's not going to just amp them up to use more. These are things we need to have conversations of as a community, and I'm very open to any thoughts or ideas of ways that we could be helpful.
So I'll jump in too and just add a few things. One is that we do have to get at sort of the social determinants. So we did pass this session some additional tax credits for families. So putting more money in families' hands, working families, so that they can provide for their family in a more effective way. And the other, and I think there's a lot more work that could be done on that, making sure that people who are working full-time have enough money to actually take care of their family, because it's definitely been shown that if you can't, then your family isn't as successful. And that has impacts and generational harm for kids. But the other thing that I want to talk about, which is maybe, a little bit controversial, but it doesn't feel that way for me, is that early and persistent marijuana use has a really negative impact on kids' mental health. And we have pushed this product and made it glamorous and glorious, and it's a medicine, it's good for you, it's also fun. And then we've turned it into this super high potency product, and then we've unleashed that. So this year, 2 years ago, we passed a bill that made it harder for kids to access marijuana. And we saw a big drop in medical marijuana sales this year, I think in part as a result of that bill, because the bill made it harder for the kids who are 18 to 21, where there's a huge surge in medical marijuana cards, and made it harder for them to get those. The kids that need it and who are legitimately using that for a health purpose can still get it, but kids that were just accessing that and then selling it or giving it away at their high school are having, they've run into some headwinds and are doing a little bit less of that. So, but I think that's something we absolutely have to be looking at, is what is the impact of that? And there's been a lot of good articles on that have come out just recently. The other thing I think we have to acknowledge is that diseases like schizophrenia emerge in kids who are around often 18 to 25. And those things happen, and there maybe isn't prevention. And certainly not for everyone. I mean, schizophrenia has been around forever, and the number of people with it hasn't really changed, the percent of the population. And so part of the exercise here is recognizing when it's happening and then getting somebody into treatment as soon as we know that that is the disease that they have. So
I just want to add that the School of Public Health did a study on high potency marijuana that I can make available to anybody who would like to see it. But it does support what Judy's concerns are.
I would like to have you both back to do a session just entirely on marijuana policy, because going on 10 years of legalization now, it's just kind of become part of the background. But no, it's still new. We're still in the first generation of this. So I'm serious about that. We'll sit down later today.
I would love to do that. Yeah.
Absolutely.
I think we have time for one more question, even though there are more rolling in. Sarah, Sarah's hands up. I think you can, yeah, please ask away.
Hi, this is actually, can you hear me? This is Cindy Eddington, and Sarah forwarded me her link.
Right.
So I'm
Awesome.
under her identity today. But I am the behavioral health parity analyst with the Division of Insurance with Dora. So it's nice to meet everyone. And my question was, given the lack of funding at the public education space and the need for early prevention, identification, and support for our kids, what has been done or could be done to engage with third-party carriers and insurance around coverage of those services to support reimbursement at a school site as opposed to only in the, say, office setting? And thank you so much for all your help, everyone, and work.
I think, first of all, thank you for what you do. Second, thank you for bringing that question forward, because it's definitely an area we need to work on. A lot of school-based therapeutic interventions are covered by Medicaid. So we're covering a portion of the services that are provided, but not all of the services that are provided. And so it's something that we have to address, and we have to address working with your department and with insurance companies to have them cover school-based settings. So that's an area of improvement for us.
Yeah, so, and I'll just, because these are our lanes today, I'll just say a lot of school kids are also on Medicaid.
Yeah.
And we're going to really miss the boat if we don't address that as well.
All right. Well, hey, thank you, everybody, for participating. Thank you especially to our guests. I've been covering the state legislature as a reporter from CHI for about 2 decades now, and I have to say this level of expertise in behavioral health is not the historic norm, so we're very fortunate to have you both here today. With that, I'd like to close the webinar and give everybody 3 minutes before their 9 o'clock meetings start. Yeah, thanks for joining us. Check back later today to our website, and we'll have the recording on. Thanks so much. Hope you all join us again.
Thank you.